Biostatistics and Epidemiology for 5th semester students of the Faculty of Medicine, Biostatistics and Epidemiology. Biostatistics and Epidemiology for Semester 5 are two crucial subjects in medical education, aiming to provide students with an understanding of the application of statistics in health sciences and the patterns of disease distribution in populations. These courses help students develop skills for assessing health data, analyzing research, and understanding how risk factors contribute to disease spread. Here is a detailed explanation of biostatistics and epidemiology taught in Semester 5-1. Biostatistics for Semester 5. Biostatistics is the branch of statistics used to analyze data in the medical and public health fields. This course focuses on applying statistical methods to interpret medical and epidemiological data. 1.1 Basic concepts of biostatistics. Descriptive statistics, used to summarize and describe data, such as mean, median, mode, range, and standard deviation. Example: assessing the distribution of patient ages in a population or measuring the average blood pressure in a sample of patients. Probability distributions. Understanding how data is distributed in a population, using normal distribution and other distributions, e.g., Poisson or binomial distributions. Example: using normal distribution to describe blood pressure values in a group. 1.2 Statistical inference. Hypothesis testing. Discusses methods for testing differences between two or more groups, such as testing if two treatments have different effects. T-test, used to compare means between two groups. Chi-square test, used to test relationships between two categorical variables. P-value and confidence interval explains how to determine if a research result is statistically significant. The p-value indicates the level of confidence, and the confidence interval provides a range of values within which the parameter being studied is likely to lie. 1.3 Regression and correlation analysis. Linear regression, used to model the relationship between two numeric variables. For example, predicting body weight based on height. Logistic regression, used when the dependent variable is categorical, such as analyzing the relationship between risk factors and disease occurrence, e.g., smoking and lung cancer risk. 1.4 Data measurement and interpretation. Health metrics in public health. Prevalence. The proportion of people affected by a disease at a certain point in time. Incidence. The number of new disease cases over a specific time period. Mortality and morbidity. Mortality rate and incidence of diseases in a population. 2. Epidemiology for Semester 5. Epidemiology is the study of the distribution and determinants of diseases in populations and how these factors can be prevented. This course helps students understand risk factors, disease patterns, and effective prevention methods. 2.1 Basic Principles of Epidemiology. Definition of epidemiology. Epidemiology is the study of the spread and determining factors affecting health in a population. Goals of epidemiology: assessing public health, analyzing risk factors for diseases, determining the effectiveness of health interventions, public health and disease, identifying disease patterns, such as prevalence and incidence, within a community or country. 2.2 Epidemiological study designs. Descriptive studies provide an overview of disease occurrence or prevalence in a population. This includes cross-sectional studies that assess health status at a single point in time. Analytical studies analyzes the relationship between exposure, e.g., smoking, and health outcomes, e.g., lung cancer. Cohort studies observes groups exposed and unexposed to a particular risk factor over a period of time. Case control studies compares individuals with a disease to those without the disease to identify causal factors. Experimental studies involve interventions, such as vaccination, to test their effects on specific groups. 2.3 Risk assessment and risk factors. Risk factors. Factors that increase the likelihood of someone developing a disease, such as smoking, diet, or family history. Example: identifying risk factors for heart disease based on lifestyle habits. Odds ratio and risk ratio. Used to measure the strength of the association between exposure and disease occurrence in epidemiological studies. High-risk populations. Identifying groups with higher risk for specific diseases, such as individuals with diabetes being at greater risk for stroke. 2.4 Epidemiology of infectious and non-infectious diseases. Infectious diseases. Studying the factors that cause the spread of infectious diseases such as bacteria, viruses, or parasites. Example: transmission of tuberculosis through the air or HIV through bodily fluids. Non-infectious diseases. Studying the factors contributing to chronic diseases like cancer, diabetes, and heart disease. Example: identifying diet as a risk factor for type 2 diabetes. 2.5 Disease control and prevention. Prevention strategies. Primary: preventing diseases before they occur, such as vaccination campaigns or smoking cessation programs. Secondary: early detection and treatment of diseases, such as breast cancer screening. Tertiary: reducing the impact of diseases that have already developed, such as rehabilitation after a heart attack. 3. Learning objectives of biostatistics and epidemiology. Students will be able to use statistical methods to analyze and interpret health and epidemiological data. Students will understand the principles of epidemiology and be able to design and evaluate epidemiological studies. Students will be able to identify risk factors for diseases and design effective prevention strategies. Conclusion: Biostatistics and epidemiology are interconnected courses that provide students with the skills to analyze medical data and understand the distribution and determinants of diseases in populations. The knowledge gained from both subjects is essential for evidence-based decision-making in medical practice and health research.